Public Health Policy Backup, presented by Erica Mack, HCA 415, Community and Public Health, Professor Dr. Gloria Wilson, August 28, 2018. Public health issue. Tobacco use in the United States has become a larger epidemic amongst teenagers. Adults are not left behind, but the risk is higher in teens due to them still growing and the age they begin to start smoking. About half of all Americans who keep smoking will die because of this habit. Each year, more than 480,000 people in the United States die from the illness related to tobacco use. That means each year, smoking causes about 1 out of 5 deaths in the United States. Health risks of smoking tobacco, no date given. In this day and age, teens are able to get their hands on these products much faster. You now have regular cigarettes, tobacco out of the cans, chewing tobacco, and the most popular, e-cigarettes, which can be found in many stores. An estimated 63.4 million people aged 12 or older used a tobacco product during the past month, including 51.3 million cigarette smokers. The National Institute on Drug Abuse, no date given. Who does tobacco use affect? When you use tobacco, you are at a higher risk of dying, so this affects the person using the product. Tobacco users die much younger. It causes cancer, premature births in women. It could also damage your organs. Smoking as a teen can stun the growth of the lungs. It also affects the family of the person who is using the tobacco product. Children of tobacco users are at higher risk to start using tobacco at a younger age. What is the impact that tobacco has on the community? Smoking in public places causes secondhand smoke to the non-smokers. It damages the environment. It can trigger asthma attacks on non-smokers due to secondhand smoke. It causes eye irritation, hard time breathing, may cause cancer, and of course, the cigarette butts cause pollution to the community and the earth. Why should tobacco use be addressed? This is an issue that needs to be addressed because it affects teens that are smoking. Adults who smoke are also affected, and both adults and teens can be killed due to this terrible addiction. Just because one smokes, that does not mean it affects only them, but also the people that surround them. Secondhand smoke kills innocent people, and it's just not fair. Cigarettes are the main lawful buyer item in the world that make one portion of their long-haul clients. As this plague continues incurring substantial injury to teens and adults in the United States, it is likewise expanding in lower and center salary nations that are the least ready to bear the cost of the subsequent security and financial results that this may have. The proposed public health policy. Smokers who smoke outside the designated area in public places will get fined. If they are fined more than 2 times in 1 year, you will have to serve a 3-day. You have to serve 3 days in jail. That time may increase depending on the times you are caught within that year. Having designated areas for the smokers, which will be away from parks, sidewalks, stores, and restaurants. Vendors who sell tobacco to teenagers will have their stores shut down, effective immediately. Manufacturer bans on promotion of their brands, which includes no billboards, no commercials. Raising the age for tobacco purchase from the current age of 18 years of age to 21 years of age. Retailers are not allowed to display tobacco or its related products in their stores. Tobacco products are not to be sold out of any sort of vending machine. Some of the impacts of this proposed policy. With less sales on tobacco, the cities will not be gaining that sales tax. The federal government will also lose on the tax that they gain from the sale of tobacco from the manufacturer. With less sales, it can cause an impact on employees who work for these manufacturers, causing them to lose their job or receiving fewer hours. With lost jobs comes higher unemployment rates. Now, all is not negative when it comes to some of these impacts of the proposed policy. There are also some positive impacts with this proposed policy. Now, some of the positive impacts that this proposed policy will have is clean air, reduction in secondhand smoke, less pollution caused by the smoke in the air and the cigarette butts that are thrown out in the community and end up in our waters, and of course, less deaths due to cancer or lung failure or organ failure. Influential presentation affecting voting behavior of legislators. What matters most? The sale of a tobacco product and the tax that the government and city will get from it, or the health and well-being of a human life. Smoking bans have been introduced in numerous countries around the world. Following the incontrovertible link that's between smoking and cancer. Delafield, Jones, and Crotty, 2018. So why not have that same policy for the United States? If someone wants to continue smoking, then I propose that we tax higher on tobacco products. This would be a win-win for all legislators and the government. If anyone in legislation is opposed to tobacco use, then this is the time to allow for this proposed policy to be approved. The policy ensures that children do not die young due to passive smoking. The policy also seeks to reduce the harmful health effects of tobacco, such as lung cancer. The overall proposed policy will save thousands of lives in the United States. Thank you for hearing my proposal on this new health policy. Here are my references. Delafield N., Jones C., and Crotty J. 2018, August 23rd. How smoking bans could lead to the deaths of tobacco industry. It was retrieved from theconversion.com. How smoking bans could lead to the death of the tobacco industry. Health risks of tobacco, no date given. Retrieved from www.cancer.org/cancer/cancer causes/tobacco and cancer/health risks of smoking tobacco. And the National Institute on Drug Abuse, no date given. What is the scope of tobacco use and its cost to the society? Retrieved from www.drugabuse.gov/publications/research reports/tobacco nicotine e-cigarettes/scope tobacco use, its cost to society.